Good morning, all. My dear colleagues, pharmacologists all over the world. I welcome you for this today's session. Actually, this is 5 days of faculty development program, which is on the AI tools and teaching methodology and other pharmacy topics also. And today's speaker is Dr. Mallikarjun Rao from Malaysia. He's a very dynamic scientist and in the natural chemistry and other subjects also. Not only in that one, is the advanced sciences also is a very expert. I'm very happy to have such a great person here. And about our college, college started in the 2004 with the approvals of the AICTE and government of Andhra Pradesh, and college approved by the PCI also. As on today, college is offering the courses like the B Pharmacy with 100 intake, Form D with the 30 intake, and Form D PB, that is post baccalaureate with the 10 intake, and M Pharmacy with the three specializations, Pharmaceutics, Pharmanalysis, and Pharmacology. And college is having the NRF ranking also, and NBA, fourth cycle is going on. We're going to have the inspection very soon for the fourth cycle. And one more thing, this college is approved by the PCI under Section 12 of the Pharmacy Act, and college is approved by the Osmania University, where all the time our team are very good in the research activities, and we are giving the maximum effort to get the maximum result, very good result, and very good placements also. And for a small exposure to the world, if we have conducted this FTP, second time FTP, we have conducted last year, and again we're conducting the FTP, online FTP, so that is going to benefit all our pharmacy colleagues. With this, I'll forward to my colleague, please.
I'm glad to introduce our distinguished speaker, Dr. P. Mallikarjun Rao sir. Dr. Mallikarjun Rao is a highly experienced professor and the Dean of Research at Newcastle University Medicine, Malaysia. He has a strong educational background with degrees in pharmacy, including a PhD, and is a fellow of the Royal Society of Chemistry. Over his career, Dr. Rao has been a key leader in pharmaceutical sciences. At his previous university, he was in charge of research and helped create a center to turn research ideas into useful products and services. He was a he was very good at setting up partnerships between the university and other organizations, and he also helped improve research facilities and bring in more students for advanced studies. Dr. Rao is an active researcher. He has written 150 scientific papers, and his work has been cited by other scientists over 7,900 times. He also holds 6 international patents and has 4 patents filed in Malaysia for new inventions. He has received many grants to fund his research and has guided many PhD and postgraduate students. His research focuses on finding and developing new medicines using new technologies like AI in drug discovery and studying natural products. In addition to his research and leadership roles, Dr. Rao is also a dedicated teacher. He has taught many students and created new ways to help them learn, often using technology. He has won awards for his teaching style and is highly rated by his students. Overall, Dr. Mallikarjun Rao sir is a top expert in pharmaceutical sciences, known for his leadership, groundbreaking research, and commitment to educating the next generation of scientists. I now invite Dr. Mallikarjun Rao sir to deliver the lecture.
Hi, madam. Can I start? Yeah. Madam, can you hear me?
Sir, you're not audible, sir.
Okay, from my
There's an
side,
audio issue. Oh, yeah. Yes, sir.
can you hear me now? Madam, can you hear me?
Yes, sir.
Now it is audible.
Yes, sir.
Okay,
You're
okay,
audible.
okay, okay, okay. Okay, thanks, madam, for your introduction. And also thanks to Principal Sudhakar sir for giving me this opportunity to share my thoughts on how to use ChatGPT in a classroom. Okay, I hope all of you can see my slides and you can hear my voice. Okay. Uh, is it okay? Yeah.
Yes.
Okay.
Yes, sir.
Uh, okay. First of all, I am from the Newcastle University. Okay, we have a three campuses. Main campus is in UK, second campus is in Malaysia, and third campus in Singapore. And at this point of time, I am in a Malaysian campus. I am the dean of research. And here, I think most of the participants here, they might have heard about ChatGPT, or they might be using ChatGPT. Okay, and different people have a different apprehensions of ChatGPT. But here, I would like to share my experiences with ChatGPT and how ChatGPT can be used in a classroom, okay, to provide a better learning experience for the students so that they can be a good researchers, okay, in future. Okay. And whatever I'm going to share here, all these are my thoughts. No way I'm endorsing ChatGPT must use in the classroom. Okay. Just I'm sharing my experiences here. Okay. First, what is ChatGPT? It is a artificial intelligence language model by a company OpenAI. Of course, the present version is GPT-4. Okay, and it is trained on the vast amounts of internet text. Okay, it is very similar to what exactly we teach. When we teach to the students, what we do is we refer to the textbooks or we refer to the internet. From that, we use to collect the necessary and essential information. That information we will teach to the students. But what this ChatGPT do is it also do the same thing, but however, it reduces our workload. That means we need not to search the Google, we need not to search the textbooks. It will grab all the essential information, okay, which is present in these kind of a textbooks, and it give some salient points, and which can in that way actually it reduces our workload, that is a teacher's workload, by enormous amount of time. Okay, and the other thing with ChatGPT is you can talk to it. Okay, when you speak to it, it will understand what you are talking about, and also you can give like a WhatsApp message to it, and it will give you the feedback. Okay, or in traditional thing, what we need to do is everything we need to read. Okay, and that's why there is no two-way communication when we are getting the information, okay, from the textbooks. Okay, and now there are many models are there, but these three are already in a market. GPT 3.5, okay, it is free. Okay, and GPT-4, okay, of course it is a subscription based. And at this point of time, ChatGPT-4 Omni, and this is the fastest and most reliable one. And they also have a ChatGPT for the different models have a different strengths. Some are good for research, some are good for daily conversations, some are good in writing effective and efficient emails, and some are good even to write a research proposals, to write research papers. Okay, and when you compare these three models, okay, what happens is, of course, ChatGPT 4 Omni, and it is the most expensive ones and most fastest one. Okay, reasoning ability, it is the strongest. Okay, and I have been testing it for almost in my research almost every day. I test how good it is, ChatGPT. Okay, whereas this 3.5 and 4, they understand only the text, whereas here they can understand the voice, they can understand the image, they can also understand the text. Okay, and this is best for basic tasks and drafts. And suppose if you want to write an email to someone, just you can use ChatGPT 3.5, so it will give you a very good formatted email without any spelling and grammatical mistakes. Okay, GPT-4 is good. Okay, if you want to know some basic information in teaching, whereas Omni, it is a real time. That means whatever is invented yesterday, and if it is published somewhere else, automatically you can abstract that info. Okay. And how to choose the right model? Suppose depending upon the task that you have, suppose if you are writing emails or some kind of reports, okay, GPT 3.5 is okay. But if you want to analyze the data, or if you are looking at a really complex issue, you can use GPT-4. Suppose if you want to interpret a particular diagram, suppose in a textbook, if you see a diagram and if you want to you want to convey that diagram message in the easiest way, then you have to go for ChatGPT 4. Okay. Now, suppose if you are so busy that you cannot even type, okay, simply you can talk to it and automatically it will give some info. When you talk to it, actually you can talk in so many languages. It is not necessarily to be in English. Okay, you can choose, you can talk different languages and it will understand that language and it will give the information. Okay, and of course teach students using a visual or multi-style content, because suppose if you are teaching to the students, you don't want to put the text but you want to put a diagram, or you have some content in your mind and you want to convert that content into a pictorial diagram, actually it will do for you. You need not to draw anything, everything it will do for you. Okay, and here these are all my experiences. Again I'm telling to each and everyone that I am not endorsing ChatGPT is the best. Okay, and this is only my experiences with ChatGPT. It enhances the understanding of the complex topics, because you being a lecturer or we being a lecturer, since we have a lots of experience, okay, whatever the topic that we are teaching, for us it looks very simple. But when we studied the same thing either 10 years back or 15 years back, it is something Latin to us. Now the students are also the same. Okay, so when we are teaching, we think that they are understanding what we are teaching. Okay, but some students may understand, some students may not understand. So because of the complexity, and that's why nowadays the people are very scared of the organic chemistry. Even by hearing the word itself, they don't want to open the textbook. If they look at some kind of a reaction, they will get faint. Okay, or they will get stressed up. Okay, these things. And you can customize explanations and give a feedback. That means for one student you have to explain in one way, for another student you have to explain in another way. Okay, so it is very difficult for us, in what way we have to explain to the student for them to understand what I'm talking about. Because if there are two students A and B, if I talk in my normal tone or normal way, A can understand but B cannot understand. If I talk to the B in the way that he want, then A may not understand. So for a teachers, it's very difficult to give different kinds of different types of explanations for the same thing, okay, in different ways, whereas ChatGPT can help. Okay, and it saves lots of time on routine tasks. I will tell you how much time it can save. Okay, it supports multilingual and inclusive learning. Some students may not be good at English. Okay, maybe they are conversant in their regional dialect, then actually ChatGPT can help them. But in most of the education universities, usually we teach in English, and being a teachers, usually we speak very fast. Okay, and the students may have a challenges. Okay, for example, explain the pharmacodynamics of an aspirin in a simple language. For example, whatever I generated, this one, everything is from ChatGPT. I did not type a single word. I did not type a single word. Okay. So the first thing is, what is aspirin? It gives you a very good image. When the people look at it, it gives some attraction. Okay. The students will be interested to see. Whereas when we are preparing a PowerPoint presentation, even to give this kind of an idea, it takes about 1 hour time. 1 to 2 hours time, depends upon the experience, whereas ChatGPT will give you straight away. So aspirin is a medicine commonly used to relieve pain, reduce fever, lower inflammation, and prevent blood clots. That means a student who doesn't know the science and they can understand what it is. Okay, how does this aspirin work? Okay, aspirin works by blocking an enzyme called so and so. This enzyme helps these kind of a things. Suppose with this okay, with ChatGPT has given a two sentences. Am I right? Same thing. If you want to teach, usually we'll talk about maybe 10 to 15 minutes to convey the same message. So that means we talk more, and therefore the reception to the students is very less. I think nowadays the student community actually they cannot concentrate more than 10 minutes or 15 minutes. Okay, and when you talk continuously, okay, or if you are putting some slides only with a kind of a wording, they may not be interested. Whereas if you want to do create these kind of images, am I right? It takes up a lot of time. Whereas the ChatGPT can help you to do all the things for us. Okay. Then what aspirin does? Okay, it gives that COX-1, COX-2, prostaglandin production. So what will be the result? Okay, usually these are the things that we don't say. What we say that this is the pharmacological action. This is the mechanism of action. This is the therapeutic use. These are the words that we use. Okay, so most of the time we use a scientific terminology. It's good, but however, if the student may not understand that scientific terminology, that's why they find it very difficult. So in that way, ChatGPT can help, okay, to put it into a layman's language so that they can understand what they are talking, what actually they're studying about. And why is that important? In pain or inflammation, prostaglandins makes the area swell and hurt. Aspirin stops that. Okay, here what I'm requesting you all is look at the words that it uses. It uses a layman language. Okay, any person who knows a little bit English, they can understand what it is talking about. In that way, the understanding of the subject by the students will be enormously increased. And also it will say summary in one line. Aspirin blocks a chemical pathway in the body to stop pain, reduce swelling, prevent blood clots. Okay, in a simple one slide, actually we can talk everything about aspirin in a simple layman's language. Okay, and the same thing, if you want to put it into a case study, for example, Form D students, okay, they always work in a clinic. Okay, so the same thing also you can convert into a case study. For example, if I'm teaching, if I want to convert that into a case study, it's very difficult. Okay, let us say I am putting a case study. Okay, a patient with a particular name, A so and so, weight is so and so. Okay, this is the history and this is the medications that he is using. So then this particular patient visits a pharmacy with a follow-up prescription. While counseling, while he's talking to a pharmacist, he is asking that why do I need to take the aspirin every day if I don't have a fever or pain anymore? Actually, for the teachers, am I right? It's very difficult for us to get these kind of ideas because we all are busy. Okay, we are busy with so many tasks. Apart from teaching, we also do administration, we also do research. It's very difficult for us to come up with this kind of a perfect example of a case study for the students to have a better understanding. Okay, then the pharmacist is giving an explanation that aspirin doesn't just relieve pain. In your case, it's working like a blood thinner. It helps prevent another heart attack by stopping your blood platelets from sticking together and forming clots in your arteries. That is the how we use. Okay, and the most important thing is you being a lecturer or a professor or associate professor, we need to cross check whatever the information it is giving correct or not. But what it gives you is it gives you a quick idea how should I deliver my lecture. That is the best thing. Okay, then of course this is the clinical scenario. Then we can explain to the mechanism of action to that person in a simplified language. Okay, aspirin blocks COX-1 enzyme in plates. Okay, this prevents production of so and so thromboxane, all these things. Okay, this is the goal, therapeutic goal, and these are the counseling points. This is what pharmacist is going to tell to the patient, that you have to take aspirin with food to avoid stomach upset. Okay, you have to be very careful. You see that whether there is any bleeding in stools. Okay, don't stop taking the medicine without informing to the doctor. Okay, don't take the ibuprofen. Okay, okay, along with this aspirin, unless otherwise if doctor asks you to take that. Okay, so everything you can do it in a fraction of seconds. Huh? Okay, and then at the end of the session, you being a teacher, you can ask the student, am I right? Why is low dose aspirin used in cardiovascular cases but not in high doses? This is where, some of the academics think that, oh, ChatGPT means the students will cheat. The students do not learn. But you have this scenario, you have these kind of a questions, you sit in front of the student, you ask these questions to the student, then student cannot check the ChatGPT at that point of time. But the good thing with this ChatGPT is at least you should know what question you should ask, what kind of a question you should ask for them to test whether they really understand what we talked about. So these are the things, these are the questions for the student. In this way, we can use ChatGPT, especially in teaching a pharmacology. Okay. And benefits of ChatGPT for educators, that means for all the lecturers. Okay, you can generate the outline, examples, and quizzes, and I will tell you how good it is. Interactive learning. Okay, you can create a case-based discussions, and also you can create some simulations. You can summarize it. Okay, okay, whatever the content it is, if you want to summarize it in 100 words, you can summarize it. If you want to summarize it in 50 words, you can summarize it. You can generate multiple choice questions. Okay, and a real-time Q&A assistant, that means when you ask the question, automatically it will tell you the answer. Okay, then how the pharmacy students, how it helps. Okay, it helps in summarizing what they talked about, what was taught in the class. It gives more explanation. Okay, because teacher, we know that we have to deliver this much content in this many number of hours. Okay, there is no opportunity for the teachers to extend their teaching hours. Even though if you want to extend, even though you want to work outside the office hours, the students may not come. But the students want to know explanation maybe night at 12 o'clock or 1 o'clock after coming back from the second show and all those things, or after chatting with the friends. And at that time, the lecturers won't be available. Okay, so whereas the ChatGPT is available with them, actually they can do the explanations. Okay, and of course, all these things they can learn. Okay, they can actually, when they are preparing, okay, if this type of a question, what should I write? Okay, of course, nowadays all the examinations is a written one, so in that one definitely they cannot use ChatGPT. Okay, so but at least they know that, okay, if this is the question, if this is the answer I write, it looks great. Okay, and also it gives a practice questions and a flashcards. Okay, and of course, flashcards, once upon a time, it is very one of the famous technology when the people are studying for the what is it called, GMAT, GATE, and also IELTS and all these things. Okay, now let us see how we can use ChatGPT in a different subjects. Pharmacology. Explain the mechanism of beta blockers with an analogy. The analogy means whatever happens in a real life. So we are trying to explain. And these kind of explanations won't be there in any kind of a textbook. All right, and it's very difficult for the lecturers also to get these kind of ideas. Okay, here you see beta blockers are like a brake pedal for your heart. They slow down the speed and reduce the force, helping control blood pressure. So very simple ones. Okay, then you can say that your heart is like a car. Think of your heart as a car engine. When you get stressed or excited, your body releases adrenaline, like stepping on the gas pedal. Gas pedal means an accelerator. This makes your heart beat faster, pump harder. Okay, you can look at this one. How the things make it very simple. Okay, then what do beta blockers do? Okay, beta blockers are like putting a foot on the brake pedal. That means you are putting a brake. Okay, so they block the effects of adrenaline on the heart by attaching beta receptors. So then if it blocks, what happens? These are the things that will happen. And when you are talking at the end, you are giving a technical summary. That means you are talking science to the student. you are talking in a layman, then you are talking the science, then they can relate, okay, between the layman's language and the scientific language. Then, okay, you could talk about beta 1 adrenergic receptors mainly in the heart. Of course, if you want to talk, you can also say that beta 1 is also present on the other organs, especially on the lungs, okay. That's why they have a contraindications for asthma and all those things. You can bring in your knowledge, okay. And also it can say that, okay, it reduces the heart rate, it reduces the contractility, it reduces the blood pressure. That is the one thing that you can do it. And of course, there is a technical summary, okay, it will give. And from this one, again, you can generate a case study. You can generate a case study immediately, okay. Okay, the patient is so and so, age is so and so, weight is 68 kg, okay, this is the medical history, and these are the current complaints, okay, of that particular patient. These are the prescribed medications that they have, okay, and this one. And here the most important thing is you need not to follow exactly ChatGPT says, okay. It will give you an idea. Oh, I need to teach in this way. And you can change the prescribed medications, you can change the current complaints, but it gives you some kind of an idea. Oh, this is how I should teach, okay, so that they will get better, okay. Then pharmacist explanation using analogy. Again, the patient doesn't know anything, okay. He's from a poor family background, and maybe from a village. Then, Mr. Iyer, think of your heart like a car engine. When you are stressed or anxious, your body hits the gas pedal. Of course, here, of course, if you want to, in India, the people may not understand what is meant by gas pedal. So you can use the word accelerator, okay? Or if you want to use this one instead of a car, you can use a scooter. Anything you can use it, but this one gives you an idea, am I right? So releasing adrenaline, which makes your heart beats faster and harder, okay. Metoprolol acts like a brake pedal, okay. It blocks adrenaline signaling, all these things. And of course, if the patient is knowledgeable, okay, can talk, can understand the pharmacy, then you can talk about its mechanism of action and all these things, okay, if that person is an educated person, okay. And of course, you also tell, okay, you can also say that, okay, I'm giving this medicine to make sure that your blood pressure is controlled, and also to make sure that you don't get any heart failure, okay, like this. And of course, we also tell that, when they should be taken. Take metoprolol at the same daily. Suppose if you are taking the medicine at morning 9 o'clock, please make sure that you will take medicines all the days only at 9 o'clock. Otherwise, of course, you can bring in your pharmacokinetics concept, whatever the concept that you can bring it to them. Then do not stop suddenly. And all these, again, I'm saying that all the counseling points may not be applicable. This is where the teachers has to go back and check their textbooks or reference textbooks to see that whether this information is accurate or not. And if it is not accurate, just you will change it, okay. But it one gives you an idea, okay. Okay, understanding beta blockers in this one. And of course, these are the discussion questions for the students, am I right? And also these are the optional quiz for students. Hey, what will happen if this particular patient takes this medicine abruptly? Then they have say rebound tachycardia, hypertension, or even angina due to these things, okay. This is how it can be used. And not only that, actually you can generate the multiple choice questions immediately, okay, for the students, whether they understand or not, okay. So it can give this one, and it will also give you the correct answer, okay, very fast. Suppose it teaches, if you want to do everything on your own, it will take ages, okay. And you can create a true or false questions, okay. Beta blockers should be stopped immediately if the patient experiences dizziness. Is the correct answer or not? It also gives you an explanation, okay. And you also can give a short answer questions, okay. Why is metoprolol considered safer than propranolol in patients with asthma? So you can say that you can bring in the selectivity, okay. Beta 1 block receptors, it is also present both on the lungs and also on the heart, okay. That's why we need to look at selectivity. You bring in your medicinal chemistry concept, you can bring in your pharmacology concept, you can bring in your physiology concept. Actually, in that way, you can integrate all these three. Actually, later on I will tell you, okay, Here the most important thing is how the chat GPT will develop. It depends upon what question you ask. If you ask the right question, it will give you the right response. If you do not know how to ask, chat GPT cannot help you. Okay, that is the most important thing. You need to know how to talk to chat GPT. Okay, if you do not know, then it may not give you the correct answer. Okay, a clinical scenario. Okay, Mr. Iyer reports cold hands and feet after starting metoprolol. Okay, this is the patient's experience. Okay, so these kind of things in a regular teaching, it's highly unimaginable for us to teach. Okay, to get these kind of a concepts, that means same concept you can see, you are teaching from different perspectives, so that the students will understand in a better way. Okay. Then how the organic chemistry, I told you that nowadays organic chemistry means it's a big nightmare to the people. Nightmare. Okay. Of course, still ChatGPT, that version is not yet available. Actually, ChatGPT is, there is one more version. Okay. Actually, it will draw the structures. It will draw even the chemical structures. Okay. Even it will draw the mechanisms of action. Still, the work is undergoing. Okay. They are working with different, chemistry specialists. Okay, I think in future we are going to see that. Okay, okay, generate practice problems on S1 and SN2 reactions with answers. Now, being a teacher, for me, SN1, SN2 is nothing. But when I'm studying undergraduate, it's really something nightmare. During my post-graduation, I'm really not sure whether I really understood what does it mean. Okay, but when I'm reading it, yes, it looks me, yes, I understood that concept. But if someone asks me, give a reaction, hey, Arjun, can you tell me whether it is SN1 or SN2? I'm not confident, okay, to tell. So these are the my own what is called reflections when I was my undergraduate student, when I was a postgraduate student, when I was teaching. Okay, so all these are the reflections. Okay. So first thing is it will give you some kind of, okay, problem one, reaction identification. Predict the major product and type of a mechanism of the following reaction. So here it will give this one. At this point of time, it will do not draw the structure. Okay, but of course there are some trial versions are there. Okay, and in future you can see that it will draw the structure, chemical structure. Okay, and you can see that one. The answer is mechanism S1, product is 2-methyl-2-propanol, explanation. Okay, here, the another thing, of course, I also teach chemistry. Okay, one of the mistakes that I do is before I start teaching, immediately I draw the structure. When I draw the structure, that's all, the student will lose the confidence on it. I don't try to tell in a normal language. Okay, so immediately I draw, and suppose if the student is really panic, if I show the structure of the morphine, gone case. Do we need to put that student to the hospital by looking at the structure of the morphine? Okay, those kind of things. But when we are an organic chemistry teacher, our first thing is we need to draw the structure. Without drawing the structure, we cannot teach anything. Okay, that's how we start. Okay, so but here it says that it will try to put it into a simple language, so since it is a word, they can easily understand. Right? And then mechanism, pathway choice. Okay, which compound is most likely undergo SN2 reaction with sodium hydroxide? These are the options. Okay, then 1-bromobutane. Okay, I think since you all are teachers, am I right? By this time you all know that by asking the question and giving an answer, the student will learn much better than giving a lecture continuously. Okay, if you ask the question, then the student, suppose if the student goes to sleep, if you ask a question, then the student will awake. When the student awake, that brain will function. When the brain function, then whatever you are telling, he understand. If you are continuously teaching, okay, actually this is what I tell to the students always. Okay, after coming here. Okay, hey, don't miss my class, please come to my class. Why? Not to get the knowledge. Definitely if you come to my class, you will get a very good sleep. You need not to buy any kind of a sleeping tablet. Okay, if you come to my class, after 15 minutes you will get a very fantastic sleep. Yeah, as a teacher, I'm very happy because the students, they have to do night outs, they have the night life, they do not have a sufficient sleep. So if they come to my class, okay, by listening to me, they will have my class is a suppose 1 hour, definitely 40 to 30 minutes to 40 minutes, they will have a very good sleep. Okay, of course, some people, their eyes are open, but still they are asleep. But actually, we all know that when we study pharmacology, since we are a pharmacy, once we have a good sleep, automatically our brain works very well. In that way, nowadays, our teaching will help the students, not only giving the knowledge, also by giving them a sufficient, very deep sleep. Okay, these kind of things. Even though it is a sarcastic, but it makes sense. Okay. Then, of course, here they talk about this kind of a steric hindrance and all these things. Here they bring in the word of nucleophile, aprotic solvents. So you can see that you can slowly increase the depth of the subject rather than starting with this one. Okay, oh, this is a nucleophile, this is an electrophile, you need to have an aprotic solvent, then this will migrate from here to here. Okay, then the substitution will happen, this nucleophile. And when you are talking this, when you are talking this kind of a language, the people will get scared what this guy is talking about, especially when the student is a first year student. Okay. Then predict the product of the SN2. Okay. So here this is cyanide, and you can see that what solvent is used, what is the answer, all these things. Okay. That means actually this will tell you that actually we can also teach organic chemistry basics without showing the structures initially until they are comfortable with. Then you can bombard with them with whatever the knowledge that we have. Okay. And reaction rate comparison, arrange the following in the increasing order of SN1 reactivity. So you put this one, and okay, carbocation stability, then you talk about carbocation. But in general, what happens? Oh, this is the reactant. Okay, this is the intermediate. Okay, this is called as a carbocation, and we don't stop there. We'll stop. Oh, it's a primary carbocation, secondary carbocation, tertiary carbocation. So this is called tertiary carbocation. That's why steric hindrance. Secondary carbocation, less steric hindrance. Primary carbocations, no steric hindrance. This is what we talk. When we talk, we only understand, but the students won't understand what we are talking about. Okay, since they do not have this knowledge. Okay, so this one SN1 reaction depends on the carbocation stability. Then you talk all these things, then it makes things life easier. Okay, then go to the identify the mechanism. Okay, then then here, okay, and history is a moderate nucleophile. Then talk about what is this nucleophile, why it is called as a nucleophile, and what is this primary halides and all these things. Okay. And of course, polar protic solvents favor SN2 reactions. Again, the answer is false. Of course, here there are some mistakes, but I'm not telling all of them. Okay, because the time won't be sufficient. But what I'm trying to say is this gives you an idea how to teach, what to teach, what are the various ways of teaching to the students for them to understand better. Okay. Then how we can teach to the pharmaceutics. Okay. Then when I go for the tablets lecture, they say that, oh, wet granulation, dry granulation, this one, do this one, oh, this much content will be there. And the lecturer will talk about more than 30 to 45 minutes only about wet granulation. By the time he talked about the dry granulation, they do not understand what is the difference between these two. Okay. Unfortunately, most of the textbooks also will not tell you directly what is the differences between these things. But actually, this one can tell you that, wet granulation versus dry granulation, it will tell you. Of course, since I'm running out of the time, I'll go a little bit quick. Okay. Then and what wet granulation you can explain in a simple words. Okay, rather not this much kind of a text. You put it in a simple thing, then you expand. Think of it like making a meatballs. Okay, suppose if you want to say that you can convert meatballs into something else. Okay, maybe you want to make it like a chapati. Okay, like a puri, or making a vada, or making an idli, something like that. Okay, this one, dry sand into bricks. Okay, that one. Okay, then key differences. If you want to know what are the key differences, it will tell you, and also it will give you a very nice summary. Okay, that means even I'm talking about 5 minutes of it. Okay, but the students can understand. At least they may not talk in science, but they understand what is the wet granulation, what is the dry granulation, what are the differences in a short period of time before they go to sleep. Okay, and of course you also can generate immediately the multiple choice questions for them to test their knowledge, true or false questions. Okay, multiple choice questions, and even fill in the blanks also you can generate. Okay, and of course you also can give a clinical application, because in a pharmaceutics person, okay, it's very difficult for that pharmaceutics lecturer to think of something, giving an example of a clinical application in a pharmaceutics lecture is very difficult. Okay, here you can see that aspirin is a moisture sensitive and may degrade in wet granulation, so dry granulation avoids this problem. Of course we know, but we do not know, oh, this is the way that we can explain to the students so that they can understand what is its the clinical implication of the wet granulation and dry granulation. And microbiology support, okay, and bacteria culturing techniques, okay. Of course, even now also I cannot pronounce the full names of the bacteria. I'm okay with E. coli. Of course, Staphylococcus aureus is okay. But if anyone asks me to pronounce the full name of the E. coli, I have to really search here and there how to pronounce it. Okay. So these are the real challenges. These are the practical challenges. Okay. What is bacterial culturing? Okay, is the process of growing bacteria in the lab using a special nutrient-rich environments. Okay. Then you can see that why do we culture bacteria? What are the basic requirements? What are the different types of culture? Okay. Then what are the common culturing techniques that are there? Okay, then all these are the common culturing techniques. Okay, and what are the key aseptic techniques that we use? What are the incubation conditions we have to maintain, and what we need to observe while they are growing, and summary table. So that means within 10 minutes I'm talking entirely about the microbial culturing. Okay, this is an introductory class. Then afterwards I can bring back, okay, the more and more about it, so that when they see this one, and of course they really understand what it is, and in that way it also can teach. Am I right? And pharmaceutical engineering, okay, it is one of the most boring subjects. Okay, because when they're talking about milling, they talk about a lot of millings. Then suppose if you want to mill the semi-solid materials, okay, then first of all, okay, why we need to do the mill, and these are the reasons. Okay, and and what are the different types of mills: colloid mill, triple roller mill, okay, then high shear mixer, planetary mixer, okay, and ball mill, all these things. Okay, and again this comparison: what is the type, what is the mechanism, it is best for what is the output, and notes. You see, you can summarize everything in less than 10 slides, but if the same thing if I teach, I have to teach for more than 4 hours, and whatever I teach in the first hour, the students don't remember when I go to the second, when I started teaching the second ones. Okay, and of course at the end you can also give the key takeaways from here, and of course you can generate the multiple choice questions here. Okay, true or false questions, fill in the blank questions. Okay, even you can also give the matching type questions. You can also give the matching type questions. Okay, and if you want to see whether the students understand the concept, and you can say that which of the following is not a characteristic of a dry ball milling in semi-solid preparation. In that way you can generate various types of questions, whereas if you want to write on your own, you need to spend about 3 to 5, of course you have to spend days. Even though it says 5 questions, if the 5 questions if you want to develop, okay, for me at least it will take more than 8 hours for me. Okay, then how to teach, what are the things that we can do in a lab. Okay, what are the things that they need to be aware of when they're going to the chemistry lab? You have to tell them, okay, these are the things. Okay, it will tell you everything. Okay, safety goggles, chemical splash glasses. Then you can differentiate what is the difference between these two. Okay, what are the different types of gloves that are available? Even I can see that even most of the academics also do not know what are the different types of gloves that are available, and what gloves should be used for what purpose. Okay, and what is the lab coat, what is its purpose, and how it should be, whether it should be long or short, whether it should be tightly fit or it should be loose. Okay, and whether face shield is required or not, whether shoes should be closed shoes or open shoes, or we should wear a long pants or short pants to go to the classrooms, and all these things. Okay, of course we tell to the student that, hey, you should wear the shoes, you should not come with the slippers. Okay, but we do not know, because unless we explain the reason why they need to wear the shoes, they may not buy in our idea. Okay, so and what are the respiratory protection, what happens, what are the types of masks that should use, how to use the fume hood. Okay, and also you can see these are the things, tie back long hair. Okay, no loose scravers, jewelry. Okay, you need to know where is the emergency shower. Okay, don't leave spills unattended. Suppose if there is something, some hydrochloric acid is fall on the table, suppose if we do not tell, if someone comes and put a hand, it's a gone case. Okay, those kind of things, okay, we need to tell them. Okay, then okay, what are the some of the PPE checklist and all these things, you can put it into, you need not to prepare, you put something outside the lab door, then the students will know that, okay, or these are the things that what they need to do, or they should be aware of. Then you can allow them to come into the lab. Okay, then the pharmacognosy. Okay, and this is the picture that I took. Am I right? Because when we go out, there are lots of plants. Am I right? Just take a plant, take a picture, and ask ChatGPT. And when I asked this ChatGPT, it has correctly pointed out it is Atropa belladonna. That's all. Plant I saw outside. Okay, I took a picture. I asked ChatGPT what it is. It says. Then I asked so many things. So it says that shiny blackberries, purple this one, and it was also giving me the what is the toxicity. Okay, it is also talking about pharmaceutical importance. It is also pharmacological profile. It depends. That means I am talking to the ChatGPT. As a teacher, I am talking to the ChatGPT, and whatever the information that I am asking, it is giving to me in a matter of minutes. And it is also giving me the active constituents. It is also giving me the pharmacodynamics of these compounds. Okay, and of course here also sometimes that's why we should not worry too much about it. Here there is some kind of a bug. That's why the atropine can be used for the mydriatic purposes, bradycardia, antidote, and pre-anesthetic. And somehow it could not able to make it a proper table format. But we should not look at the faults in the ChatGPT. We always should look at what is the greatness in the ChatGPT, how it can help me, how it can reduce my workload, how it can help the students for them to understand, how can I be a better teacher, okay, how can I be a better researcher, okay, like this. Okay, then it will also talk about this one, toxicity and adverse event treatment. Okay, and pharmacokinetics, it also talk about pharmacokinetics. Usually when we teach a pharmacognosy, we don't talk about pharmacokinetics. Okay, we don't talk about the regulations, we don't talk about the formulations, only we talk about a few features that I'm going to show you next slide. Okay, these are the some of the summary table. Okay, and these are the things that what we do. Okay, even we can create a case study. We can create a case study of the belladonna. Okay, and here purposefully took, it's a child, 9 years old. That child doesn't know. Okay, maybe when they go out, okay, they will try to pluck some cherry fruit is there, then she pick up and eat. Doesn't know. You see, it is so clever. It is not giving an adult, it is giving a child, 9 years old child. Okay, that is the greatness of the ChatGPT. It won't give the 50 years old person, because 50-year-old person cannot pluck any cherries that whatever is available on the plant. Okay, then they have all these complaints this particular child has, and parents found a plant with blackberries and purple flowers near the scene. A photo sent to the poison environment and was identified as a Atropa belladonna. You see that in a pharmacognosy itself, because when we teach a pharmacy, most of the things we think that we can create the clinical case studies only from the pharmacology, but not from the pharmaceutics, not from pharmacognosy. Okay, then pharmacological basis of the symptoms. This is actually we don't tell. We simply say that these are the side effects, but usually we don't explain. Okay, what are the reasons, what are the mechanisms of action involved behind these kind of side effects. Okay, so then the diagnosis, okay, and what is the treatment that can be given, and what is the outcome, okay, outcome that was happened, and of course here what is the learning points for the students, what are the discussion questions for the students to test their knowledge. Okay, then of course whether belladonna has any kind of interactions with modern medicine. Actually it can give you, okay, whether it has anything. Okay, and all this kind of information won't be available in a pharmacognosy textbook. Okay, in any standard textbook you don't find all this information whatever I have shown in this 5 to 6 slides. Okay, of course it also can talk about macroscopic identification. It also can talk about microscopic identification. Okay, it also can tell you the powder microscopy. Okay, and it also do the chemical tests. It also do the thin layer chromatography, do the quantitative. That means ChatGPT is like a textbook. It's like a textbook. Okay, whatever you find in a textbook you will see, but the great thing is it will also tell you what is there in the research papers. It is also tell you what is there in different websites. It is also tell you what research has been carried out on that particular thing. So that is the thing. Okay, then of course it give you the summary support for the students to understand, and how it can sorry, there is a overlap, how it can do a support in research. Okay, this is a particular picture that image that I have seen in a paper. I'm very busy person, I have to do lots of things, administration, teaching, research, so many things. So at this one, okay, I want to take care of the ChatGPT. Then I put this image into the ChatGPT, and ChatGPT is telling that it contains 3 panels, A, B, and C. See here, you see A, B, and C. So it is telling that it has a 3 slides, 3 pictures in it, and it is telling what each picture is talking about: gene ontology, focused geobiological data set, and pathway analysis. And it is going to explain what is the panel A is talking about, what is panel B is talking about. And I need not to scratch my head. Of course, when it gives this one, I have to go back and check. Maybe I can sleep on my bed and see, oh, this is what it says, whether it is right or not. I can check. I can do it in a relaxed way. Okay, rather than looking at the image, oh, what is this, what is this, what is this, write down and everything. Okay, then okay, it will also, this is kind of a research support that it can give. Okay, so it will make our life easy to understand what research is talking about. Okay, and overall it also gives the what is the summary of it. Okay, and at the end it also gives you the summary. Okay, then these are the myths and facts that I want to tell. Okay, this is what the most academics have. ChatGPT encourages students to cheat and plagiarize. Plagiarize means copy, but actually fact is not that. ChatGPT can be misused if not guided properly, just like any technology. That means if they do not know how to prompt it, okay, I tell you, without the scientific knowledge, of course, here I have covered almost all the areas in the pharmacy. The reason for that is I have an experience. I don't think that student can do such kind of a things. Okay, and this is the educator rules. So you need to have some kind of an assessments. Okay, so that was just 5 minutes. I'm going to complete it. And students won't think critically if ChatGPT writes for them. It's not right. Okay, then you ask them. Right? Ask them to talk. And ChatGPT means we are lowering academic standards. It's not at all. Actually, you are learning. You are increasing their standards. Okay, because you are asking with a very lots of tough types of questions, different types of questions. Am I right? And ChatGPT always give accurate answers. It's wrong. ChatGPT, I can tell you, depending upon what version you use. Okay, sometimes it may give you completely 90% wrong answers. Okay, so this is not right. Okay, ChatGPT can go wrong. Okay, so you need to verify, and teachers don't need to adapt. This trend will fade. Oh, sometimes it doesn't work. Okay, sometimes it's no. It is going to happen. It is going to be there. It is really going to be there. Okay, and because a lot of things are happening, because it went up to such a level, even Harvard, Oxford, Cambridge, and Stanford, they encourage their students to use ChatGPT, but they tell that how to use ChatGPT appropriately. Okay, then ChatGPT can grade assignments for me. No, it won't grade assignments for you, but it will tell you, the summary of the answers that was given. In one way, it is help, especially when you are answering, marking the essay type questions. It's very difficult for us to read. But if you take a ChatGPT, it can help you, put it there, and it will tell you what are the salient points. From that, actually, you can mark it much faster. Okay, using ChatGPT. ChatGPT will make teachers obsolete? No, but this is the key statement that I want to see. Teachers who use AI thoughtfully will become more effective, not less relevant. That means teachers who knows AI, how to use AI effectively and efficiently, they will survive. But the teachers who don't use how to effectively use AI, maybe they may have challenges. And what teachers can do, okay, AI is a cheating, it's not. You can redesign your assessments. And AI, of course, as per Indian regulations, everything is written so that they cannot use ChatGPT there. AI lower standards, definitely it's not. AI replaces critical thinking, definitely it's not. Okay, AI make teachers obsolete, definitely it's not. Okay. And a summary here, AI is not the enemy of education, it's a tool, okay, like a calculator. For example, when I was small, the people never allowed me to use a calculator. But nowadays, the people are using a calculator. Okay, when I'm typing my PhD thesis, the people do not allow me to use a, what is it called, computer. Okay, they ask me that I should use a typewriter. I have to write, I should use a typewriter. Okay, it's only waste of time. Okay, that time is no, but now everyone is using a computer. Now when you use a Microsoft Word, it will make lots of corrections, okay, for yourself. And here, that is the most important point. So that's why nowadays when the people are using Word, they are assuming that MS Word is going to correct me everything. That's why nowadays you can see more mistakes in PhD thesis than before, because they are over reliant on Microsoft Word. They think that, oh, it is going to correct me everything. It's not. It's not. But it is going to support you. It is going to lessen your this thing. Okay. Then way forward. Okay. ChatGPT promotes plagiarism. It's not true. Okay. Students will stop thinking all these are not true. Okay. Then how ChatGPT can help teachers? These are the various ways. I know that I have another 4 minutes. I'm going to complete this. Okay. And pedagogical strategies for responsible use. Okay, these are the things: redesign assignments, responsible use in practice. Of course, if you want to talk, we can talk a lot about it. Thank you for your attention. And again, I'm telling this entire presentation I have prepared in 45 minutes by using ChatGPT. Okay, I have spent just 45 minutes. I am traveling from one place to another place, okay, in aeroplane. So in that one, I put all my thoughts into it. Okay, of course, there itself I asked ChatGPT, this is what I want, this is what I want. During travel, I did that. And after coming to my office, I have completed this presentation in 45 minutes. Okay, 97 slides. That is how effective it is, how efficient it is if we use it appropriately. Thank you for your attention. I am happy to answer any questions.
Thank you, Dr. Mallikarjun Rao.
Yes.
Sir, a very, very useful session, not only for the teachers, for the students also. The present generation require this type of topic. Actually, yeah, we have gone through this all these departments like engineering, microbiology, pharmaceutics, and whatnot, pharmacology, cognosy, almost all departments covered. What is the importance of the chat GPT in all these departments? How effectively you can teach and how effectively you can reach the students is also clearly discussed. And I think my students are also attending the session. Hope they're also enjoyed. And very much useful, not only for the regular teaching, the students can prepare for the GPAT, PGCET, or GRE. And what are the questions asked? What are the expected questions? What are the answers for that? And what are the alternate answers, alternate questions and all? For all these things and all, I think ChatGPT may be useful. So I hope all the teachers can utilize this ChatGPT. But I hope strongly that ChatGPT is not a substitute for a teacher.
No, no.
Let me hope that.
No, it's not. It's
Right.
not, sir. Sir, since you brought this one, Sudhakar sir, I want to say, you say bring in
Yes, please proceed for us. There is no time limit for us. There is no time limit for us. Please proceed.
okay, since you brought in GPAT, am I right? Suppose
Yes, sir.
you can upload last 5 years questions, am I right? You can ask ChatGPT what are the highly likely questions for this next year. It will give you the predictions. Yeah, it will give you the trend. So in that way, it helps.
For the next questions also.
For the next future questions, because the
Oh,
people
good,
will
good,
follow.
good.
The people will follow the pattern. The people
Yeah,
will
and
follow the
try for
pattern.
the
Am I
our
right?
university question papers also. Try.
Yeah. Those are the things. Of course,
Our internal questions and the future questions they may expect from the
no,
ChatGPT.
no. Actually, students can
Okay.
do that, but what teachers can do is, hey, can you generate a question which is not following this particular trend? That also teachers also can use in that way. Yeah, in that way it is both helpful both to the teachers and also the, yeah. Okay.
I think we can make our teaching more effective. We
Yes,
can
sir.
prevent them from sleeping also, as you
Yeah,
said in the
yeah,
class.
yeah. That's true. Yeah,
And of
that's
course,
true.
we also practice the same. Every 15 minutes, I ask my
Yeah,
teachers to ask a question to the students so
yeah,
that
that's true.
they can, whatever
Awake.
distraction they had it mentally,
Yeah,
they'll come back
yeah,
to classroom.
yeah,
And of course, artificial intelligence, ChatGPT, is all subsidiaries, or I can say additional points to our natural intelligence. I feel that,
yeah,
and hope that all the students and faculty also they can utilize this ChatGPT procedures and to crack this GPAT or a GATE, or I can say GRE, IELTS, and GMAT and other competitive examinations also. Even the DA examination. We used to have so many UPS examinations also. So in all ways, I think it is very good, very much useful. So try to utilize it in a proper way so that they can crack all the any score, they can get any job in the future. So I think it's very useful for the students also because all my students are attending. And I proudly say that Dr. Balkazana was my colleague in the previous college, that is Vishnu Kalya Pharmacy Bhimavaram. I'm very happy to see him again after a long time. Now I request my faculty to proceed further.
Madam, you are muted. Madam, you are muted. You are muted. You are muted. Madam, you are muted. We cannot hear.
Yes. Sir, now we'll move on to the question session, sir.
Thank you.
There are few questions, sir, which are posted here.
Yeah, yeah,
The first question, sir.
yeah, yeah.
PowerPoint presentation is not available uh, many times for downloading downloading from the Chat GPT. It was posted by Pavan.
No, no, actually, no way you can download the PowerPoint presentation from ChatGPT. Okay, only thing is it will because okay, I want to be very clear. I did not get this presentation entirely prepared by ChatGPT. It is prepared by me. I received the content from there, and PowerPoint doesn't work. If anyone wants to download, because they're purposefully stopping it. They're purposefully stopping it unless otherwise you have a corporate membership or subscription to the ChatGPT. Again, I want to say that ChatGPT cannot prepare the whole PowerPoint presentation for you. If at all, sometimes you do. If do also, it will be not the way that you like, and they're purposefully discouraging that thing. So that means, but it gives you the content. Definitely PowerPoint cross no.
Yes, sir. The other question, can you explain that how we can use ChatGPT in research publication? It was posted by Rashmi and Pavani also.
Okay. For example, it depends upon, suppose if you are writing a review article on a particular topic, okay, but you do not know what is there in the literature, what is already published, then you can ask ChatGPT, hey, I want to write a review article on so and so topic, okay, can you please suggest me, okay, what are the topics that are not being published so far, okay, then you have to say that, please, of course you can say, please give me 10 ideas, please give me 10 ideas. Then it will give you the 10 ideas. Then you look at them, you see whether you are happy with them or not, you choose one of them, then later on you continue to write it. Suppose if you are writing a review articles, suppose if you want to do a particular research, a groundbreaking research, okay, something no one has done, okay, for example, here I have taken a particular plant, many people are working on a particular plant. They can take that particular plant and they can ask ChatGPT, hey, I want to do some kind of a research on this particular plant. Can you please tell me, okay, what activities it is being tested and what activities it is not being tested? It will give you the list. Okay, from that you can choose. There are different ways of doing it. Yeah, I hope I answered the question, Sanjay.
The next question, sir. How reliable is the information from ChatGPT by Anand?
Not at all reliable. That's why throughout my lecture I'm telling you it gives you the idea what to teach. So you need to go back and check. You need to go back and check. Otherwise, if you write a review article or some research only based on the chat gpt, those researchers will be blacklisted, because nowadays there is some software which can detect the AI, okay, which can detect the AI written text. Okay, they accept the AI written text, but provided they will also will check, because there is a AI detector is there. Some few softwares are available. It will tell you that 100% written by AI, okay, or majority of the work written by AI, or 40% is written by AI. So again, I'm saying that until unless you cross check whether the information is accurate or not, okay, then you may ask me, Arjun, then what's the use? What's the use means at least ChatGPT will tell you what you have to look for. Otherwise, you do not know. You are going with a blank idea, so it's just you are going to Google and you don't know what to search for. Okay, in that way it will help you. In general, what the people say that is it will reduce the researcher's time by more than 50 to 70% of the time. That means if I'm spending 8 hours a day to get a particular topic, okay, but by using ChatGPT, I can get the same information within 2 hours. So, or AI, that means ChatGPT saves only your time. Okay, it won't give you the direct answer. Yes, madam.
Next, one more question, sir. So, which is better for creating analysis, analyzing scientific content, ChatGPT or cloud?
Of course, ChatGPT has a many versions, okay, and some images as ChatGPT can do better, and some images, I think when they say cloud, I feel that they are referring to the thing called Gemini, which is from a Google, okay, yeah, it will do. And nowadays, what happened is there is a new technology came. What that new technology came is they put all these things, that is ChatGPT, Claude, Sipol, uh, Gemini, and there are few others. It will put all of them. Am I right? So it will ask the question for all these ChatGPT, all these GPTs. Then it will give you the summary of from all these things. But it's very expensive at this point of time, and there are available. Those softwares are available, so that gives more and more reliability. But however, until now there is nothing which is 100% reliable and accountable. Sorry, reliable and we can blindly follow. Yeah.
So, that's all the questions, sir.
Thank you, ma'am.
Thank you very much, sir, for your insightful presentation and sharing your expertise about ChatGPT, its benefits and applications in pharmacy education, sir. I hope it is very informative session for all the audience there. Um, the next session resumes sharply at 2 o'clock. Thank you very much, sir. Thank you all.